Now for the 15th, we are going to discuss right here today. We are going to talk about the posterior urethral valves. Posterior urethral valves. Okay. So what's the posterior urethral valve? Is it a normal thing or is it an abnormality? So there are actually common causes of lower urinary tract obstruction in male infants. You can get to see that they can cause issues, right? So they are congenital. Okay, so there are congenital obstructing membranes in the posterior urethra. They impair with urine flow, so this can actually lead to bladder dysfunction. Hydronephrosis, where there's accumulation of fluid in the kidneys, and potentially they can lead to renal damage. So pathophysiology, they are congenital. Okay, so there's abnormal folds of mucosa in the posterior urethra, so they are the ones that actually act as obstructing valves. So they cause increased bladder pressure, poor urinary stream, incomplete emptying of the bladder. Okay, I have the pictures here. Okay, where you are seeing the posterior valves. Okay, posterior valves. So clinical presentation in neonates, you see that there's a poor urinary stream. If the babies try to ease themselves, the force is not much. Okay, it's just dull like that. Then palpable bladder. Okay, urinary retention, renal failure, respiratory distress. Then in infants and children, there's recurrent urinary tract infections, there's failure to thrive, there's incontinence or dribbling urine. Okay, then if all these issues continue over time, it can lead to chronic kidney disease. All right, so diagnosis, they do ultrasound, perinatal ultrasound. Okay, prenatal, that's when you have not even give birth to the baby. Okay, then postnatal ultrasound, so voiding cystourethrogram, then renal function test, just to assess how the kidneys are still maintaining their functions and all. So management, you catheterize them just to relieve, the struggles of easing their self. They try to correct electrolyte imbalance, and if this will bring up any infection, you also try to correct the infection. So definitive treatment is what things like endoscopic valve ablation. Then long-term care is you monitor renal function, you treat bladder dysfunction, then you manage chronic kidney disease.